Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before starting with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, courses, review books, and more to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. And I would love to work with you if you need any assistance as well. Before I get into the questions, let me just congratulate you ladies again. I had two of my one-on-one reviewers who took boards on yesterday and passed, one on the AANP and one on the ANCC. So help me to congratulate them and all of you who are testing soon. I am praying for your success. But, I always like to get into my disclaimer before starting into the question and my reminder. There's no absolutes in medicine. We treat on a patient by patient basis. Any of these questions that I provide to y'all, I have designed and created based off of the guidelines that are currently being tested on the ANCC as well as AANP exam. Any of the videos that I teach on things that we currently do in practice, I will always say that so there's no confusion, okay? So, with that being said, let's get into the questions for today. Okay, so question number one states the nurse practitioner has diagnosed the patient with cholestoma. She has explained the cranial nerve that can be affected with this diagnosis. What is the appropriate cranial nerve associated with cholesteatoma? Is it cranial nerve 2, cranial nerve 8, cranial nerve 7, or cranial nerve 3? Take a moment and tell me what you got in the comments, you guys. All right, you guys, I always recommend reading the stem of the question first. So that allows you just to slow down and ensure you're answering what is even being asked. So the stem of the question here states, what is the appropriate cranial nerve associated with cholesteatoma? So, and that's really everything the question is about. So you first need to know what that is. Cholesteatoma is where dead cells have built up in the ear canal and structure, and it can have malodorous drainage. And it's commonly known as that cauliflower appearance, sometimes secondary to just having chronic ear infections throughout the years. But this can affect the facial region. So of course that is cranial nerve 7. So this is more of a knowledge based question. So just make sure you know when you see cholestoma or the cauliflower like growth that you think of facial cranial nerve 7. So your best answer is C. Okay. All right, so question number two. A patient returns to the office today with complaints of continued fever, cough, and pleuritic chest pain. He was treated for community acquired pneumonia 20 days ago with azithromycin and amoxicillin. Upon examination, the nurse practitioner diagnoses the patient with community acquired pneumonia and plans for continued treatment. What is the best treatment to provide at this time? Is it A, doxycycline, B, clarithromycin, C, ciprofloxacin, or D, levofloxacin? Take a moment and tell me what you got in the comments, you guys. All right, so stemming the question states, what is the best treatment to provide at this time? So, I always say if it's asking you about treatment, you need to run it back and see what the diagnosis is. See if they're providing you with a diagnosis. And if they are not, you got to run it back a step further to ensure and see what the assessment is to come up with a diagnosis. So, here they're telling you that this patient is returning continued fever, cough, pleuritic chest pain. He was just diagnosed with community acquired pneumonia and treated 20 days ago. So it sounds like he's still having CAP, community acquired pneumonia, right? And so the treatment has not resolved his issue. He had it 20 days ago. So knowing this, how would we proceed with treatment for community acquired pneumonia? So this is where you need to know your first line therapies, your second line, your third line, right? So here we know that we have done the treatment. But also, we know when we have had someone on antibiotics within the last 90 days, 3 months, that we want to go with the respiratory fluoroquinolone, right? So the best answer here is D, levofloxacin. All right, you guys. And so, question number 3 for today. An African American male patient presents to the office today for follow up. He has a history of hypertension and seasonal allergies. He currently takes chlorothalidone daily. Vital signs today are blood pressure of 142 over 84, pulse is 74 beats per minute, respirations are 20, and the temperature is 98.8. Based on these findings, how should the nurse practitioner treat? Is it A, start lisinopril, B, start losartan, C, start amlodipine, or D, do we want to continue the current therapy and have the patient follow up in 2 weeks? Take a moment and tell me what you have in the comments. All right, so STEM the question states, based on these findings, how should the nurse practitioner treat? Again, if they're talking about treatment, you want to run it back and see what the diagnosis is, right? And if they haven't provided a diagnosis, you're going to run back and see what the assessment is so you can figure out a diagnosis, right? So here we have an African American male patient that came into the office. He has a history of hypertension already. He has seasonal allergies, already taken chlorothalidone for his high blood pressure, right? So the vital signs are blood pressure is 142 over 84. So we're still not managed well, clearly, because remembering what our goals are. So if someone already has this history of hypertension, one, if they have other comorbidities such as like hyperlipidemia, diabetes, chronic kidney disease, all of the things, we don't want them to exceed 130 over 80. We begin treating at that time because they already have other risk factors. So we're not trying to wait and allow them to have additional issues, right? Or higher blood pressure. If they are healthy, you don't want them to exceed that 140 over 90 range. We've already seen that medication has been implemented, but he's still exceeding 140 over 80, so we need to add in something with this chlorothalidone. Being that he's African American, the best thing that we know with African American patients is that they typically respond better to thiazides and calcium channel blockers, but also in combination. Chlorothalidone being that they're already on a thiazide, let's add in a calcium channel blocker for the combination. So C, amlodipine is your best answer. Okay, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. And as always, if you need any of the resources that I offer, just contact the Nursing Studio at 803 400 6864. You can also shoot a text to that number or shoot us an email at thenursingstudio1@gmail.com. Now, the things that are offered, as I always say, is my review book, which is an ebook option, as well as the paperback option. Both are linked in the bio of this channel. The self-paced independent course is for family and adult GRO preparing for the ANCC and AANP, and that's also linked in the bio of this channel as well. We have our upcoming 5-week intensive review, which is a group course, and that is starting on June the 10th. I still have that one spot available for that. And then lastly, our one-on-one sessions are specifically designed and customized for you. So I always say give us a call or shoot us an email if that is something you're looking for so we can gauge what you need. We do one-on-one sessions to focus on weaknesses. So if you have a particular area that you struggle with, that can be a route that you take for the one-on-one sessions, or the custom package is based off of, say, that you just don't know how to study or how to structure your studies and just need someone to help you and work with you throughout your study plan, or you've been unsuccessful before and are looking to figure out how to restructure and get back to be successful. Those are what our custom plans are for. So just give us a call or shoot us an email so we can get that set up for you. But always, as always, you guys make sure you meet me back here. Happy studying. Bye, y'all.